everyone. Today we are going to study pathology and our topic is circulatory disturbances. Firstly, we will see what we will study inside this topic, the content of this topic. First one is hyperemia. Second, we will study edema. Thirdly, we will study thrombosis and then embolism and then ischemia and infarction. But today we are going to discuss about hyperemia, and in later session we will discuss about other topics. But before we elaborate hyperemia, let's understand circulation. Circulation is the mechanism of distribution and return of the blood to and from tissues in a manner of circular movement. As you can see in the following diagram from Mohan book. This diagram is important for exams, so you can draw this image. Now let's elaborate hyperemia. Firstly, it is an active process where there is arteriolar dilation, that is, it is in from atrial side. Here hydrostatic pressure is increased and is always associated with edema. Mainly there are two types of hyperemia, active hyperemia and passive hyperemia. Active hyperemia is also known as physiological and passive hyperemia is also known as pathological. Active hyperemia is also an acute form of hyperemia. Now what do you mean by active hyperemia? It's a dilatation of arteries, arterioles and capillaries affected through sympathetic neurogenic mechanism and via release of vasoactive substances. I repeat, in active hyperemia, dilatation of arteries, arterioles and capillaries is affected through sympathetic neurogenic mechanism and via release of vasoactive substances. Now the affected tissue is pink or red erythematous erythema. Affected area is warm and affected area is swollen. Example of it is at the site of inflammation, in skeletal muscle during exercises, menopausal flush, increased blood flow, high grade fever, etc. That was about active hyperemia. Now let's see passive hyperemia. As we have already discussed, passive hyperemia is pathological, that is often related to disease, often a response to disease. Okay, it happens when blood is clotted and it can't flow. Now what is the proper definition of passive hyperemia? It is a dilatation of veins and capillaries due to impaired venous drainage which result in passive hyperemia or venous congestion. Let's see what is congestion. Firstly, it may be acute or chronic. That is, it is of two types, acute and chronic. In congestion also there is associated edema. Congestion is also associated with edema. Hydrostatic pressure is increased here also, but it's a passive process and impaired outflow is from venous side. The question which can be asked in exam is the difference between hyperemia and congestion. But before that, you should also know that congestion is of two types, systemic and local. Example of congestion is systemic in cardiac failure, reduced outflow of blood from a tissue, isolated in venous obstruction. After this, I am sharing some pages of my notes. Kindly note it down because it's important for exams. In this slide, you can see there's a difference between hyperemia and congestion, and you must know this. And in this we will see what are the similarities in hyperemia and congestion and what are the differences in hyperemia and congestion. Firstly, as you can see, blood volume is increased in both, vascular volume is increased in both. Mechanism of hyperemia is through active chemical and mechanism of congestion is through passive stagnation. Vascular compartment of hyperemia is arterial side, whereas for congestion it's venous side. Site of hyperemia is usually local and site of congestion is local or systemic. Now let's see chronic venous congestion, lungs. It occurs in left heart failure and it's also known as pulmonary congestion. Pulmonary congestion is again of two types, acute, chronic. Acute, you will see collection of blood in the septa of alveolus. Small hemorrhages happens there, there is vascular dilation and you will see patients with pink frothy sputum because there is small hemorrhage happening there. In chronic pulmonary congestion, you will see septa of alveolus get thickened and you will notice in histological section there is heart failure cells which is namely siderophases and these are found in alveolar lumina. You must also know siderophases are the macrophages which have ingested hemoglobin, that means which eat hemoglobin or which have eaten hemoglobin. Now let us see CVC of liver, that is chronic venous congestion of liver. It occurs in right heart failure, sometimes due to occlusion of inferior vena cava and hepatic vein. Microscopically, you will see a cut section in microscopically when you will cut it in section, you will see a nutmeg appearance, that is red and white areas are seen. Now this diagram is important for exam. This hexagonal structure in which you will see in the center congested central vein and hepatic sinusoids which are attached to atrophied central hepatocytes which are due to presence of necrosis, hypoxia and anoxia. And the circular structure you will see after that is the fatty changes in the mid-zonal hepatocytes due to relative hypoxia. And the rectangular or square structure with dot is the normal peripheral hepatocytes. Now let us see CVC spleen. It occurs in right heart failure and in portal hypertension from cirrhosis of liver. Microscopically, you will see fibrous thickening of capsules and of trabeculae. The important point in microscopically, that microscopic view is, you will notice gamma-Gandhi bodies or siderofibrotic nodules, which are formed when some of hemorrhages overlying fibrous tissue gets deposited of hemosiderin pigment plus calcium salts. That means these hemorrhages overlying fibrous tissue gets deposited with this hemosiderin pigment and calcium salt, and these structures are called gamma-Gandhi bodies. And you can also write that gamma-Gandhi bodies consist of hemosiderin, gangrene, fibroids. These all are present in that. Okay. So now this topic of hyperemia ends here. In next session of class, we will discuss edema, thrombosis, embolism, ischemia, infarction. But for today, that's all. Thank you.